Hi, Lindsay, the insurance girl, here today to talk a little bit about Medicare Advantage plans and Medicare supplement plans. So, I don't want to freak anyone out. I probably did if you watched the video about original Medicare and the problems with it. I promised you the solution, and today that's what I'm going to talk about. So, there are two routes that people typically take to avoid or to fill in the gaps left with original Medicare. There's a Medicare Advantage plan or a Medicare supplement plan. Oh, I hurt my finger. Good thing we're talking about healthcare. Okay, so we're going to talk about both of these plans today. I do want to really stress the fact, listen to me closely. It's up to you what you want to do. And no one gets to tell you what you're going to do, including me. What I think doesn't matter, and what other people think doesn't matter at all. I am constantly seeing people post things on social media with very strong opinions, one way or the other, about what Medicare option people should do. And that actually kind of bugs me because guess what? It's your decision. It's your healthcare. And what works really, really good for that person may be a horrible choice for you. So please make up your own mind on this. You can listen to the opinions of other people, but just because everyone that you know goes with a certain plan does not mean that that's the right plan for you. It doesn't. So there are so many factors to take into account. So please use your brain. You decide what's best for you. And okay, that's the end of that rant. So we're going to start talking a little bit, and I'll go into more depth on other videos, but I want to just kind of talk about the differences between a Medicare supplement and a Medicare Advantage plan. Both are really, really great options. Both have the exact same end goal, which is to eliminate the gaps in original Medicare. Both will help you do that. They just work in completely opposite ways. So, a supplement is something that you will pay for on a monthly basis with an additional monthly premium. So you've got your Part B premium that you'll be paying every month. With a supplement, then you'll add on another premium to pay for that supplement. Now, supplements are very popular with people that like to travel or maybe are snowbirds and live somewhere exotic like Florida for half the year. Jealous? Yay, Florida, except for the alligators, not a fan. Anyway, if you like to travel and you don't really care about sticking with a specific network of doctors, then a supplement is for you. With a supplement, you can go to any doctor anywhere in the United States, as long as they take Medicare, you can go there. If you have heard about some fancy schmancy specialist out in New York City and you want to give them a try, go for it. As long as you can get on their calendar, you are in with a supplement. It does not matter. Supplements, you do not need to get a referral. You can go. Head on out there. Go to wherever you want. Don't worry about getting a referral. You are good. You can go to anyone. Okay, I think I've hit that enough. The next thing to know about supplements, and this is very, very important, once you're on it, it's guaranteed renewable. So let's say you're on a supplement. You are doing some of this exotic traveling in Florida, and you happen to get a flesh-eating bacteria. Very rare, very terrifying, very real. That can actually happen. I had a professor in college that had a flesh-eating bacteria. True story. Anyway, you get this bacteria. Guess what? They cannot kick you off. You're on your supplement. Doesn't matter what your health is like once you're on it. You are good to go. So that is good news, especially if you have a flesh-eating bacteria. The other thing to keep in mind with these supplements is it's guaranteed issue as long as you are in your initial enrollment period. So when you are first enrolling in Medicare, in your first 7-month window of enrollment, they have to take you. Even if you already have a flesh-eating bacteria, even if you already have some other strange exotic disease that no one has heard of, it does not matter what your health is like, as long as you are in your initial enrollment period, it's guaranteed issue for a supplement. Now, supplements, this is so fun that the government did this. I just love it. They are all named after letters of the alphabet. So just like the parts of Medicare are named after the letters of the alphabet. The Medicare supplement plans are also named after letters of the alphabet. Parts and plans, different things, same names. The plans of Medicare are A through N. Some of the letters aren't actually in there, so they're not all of the letters, A through N. But I like to focus on Plan G. It seems to be the most comprehensive, definitely the most popular, covers a lot of stuff for you. So the plans are all standardized, meaning they're required to have the same benefits. It doesn't matter what company you get the plan from, it's going to have the same benefits. However, they're not required to cost the same. So different companies can charge different money for plans with the same benefits. This is a reason it's a great idea to have an independent broker helping you through this. An independent broker can look at all the different plan options and can really help you decide which way you want to go. Are you more concerned with having a plan that you recognize the company, or do you just want to go with the cheapest plan? Totally up to you. It's your healthcare, remember that. But I can look at all of the different plans and see what your best option is. Okay, we're gonna go deeper into supplements in another video, but I also did want to mention that when you have a supplement, so you have your Part A, your hospital, your Part B, your medical, you add on your supplement, but you still don't have prescription drug coverage. So that's another part of the puzzle that you have to add on. Prescription drug coverage is not included. So that's another little a la carte plan that we can add on. And there's all different options, but that is another monthly premium that you will be paying in addition to your Part B and your Medicare supplement, and then you'll have your prescription drug coverage. If you want additional benefits like vision, dental, hearing, those are also little pieces of the puzzle that we can add on. We can build your little tower of your own personalized plan. Okay, so that is a Medicare supplement. No large out-of-pocket expenses because you're paying a monthly premium instead of, and that's all you pay. You don't pay co-pays, you don't pay co-insurances. There with a Plan G, there is a Part B deductible of $240, but that's really the only out-of-pocket expense you'll pay beyond those monthly premiums that you're paying. Okay, so now we're gonna switch gears completely and talk a little bit about Advantage plans. Again, a great option, just completely opposite from a supplement. So with an Advantage plan, you're gonna have a network of doctors and hospitals that you need to stay within. And most people have heard of an HMO or a PPO. Most people are very familiar with these. Let me remind you, an HMO, Health Maintenance Organization, you have the network of doctors and hospitals, you have to stay. You cannot go outside of that. If you have a PPO, you have the network, and you can go out of network. You're allowed to, you'll just spend a little bit more money if you go out of network. So you're dealing with HMOs and PPOs. I think people are scared of these because back when they first came out, your options were so limited. I remember as a child, like I had to go to one specific building in town, and that was the only place I could go to see my doctor and to get prescriptions filled and do whatever I needed to do. It was one place. A lot of these networks these days are very, very expansive. So that's not as much of a problem depending on where you live. So networks that you stay within. However, you don't pay any additional monthly premium. So at the supplement, you're paying an additional premium. With this Advantage plan, all you're gonna pay for the most part is that Part B premium. In 2024, it's $174.70. There's no additional monthly premium. Instead, you're paying for your healthcare kind of as you go with co-pays and co-insurances. Now, as supplement plans are all very standardized and the benefits are similar, with these Advantage plans, oh my goodness, nothing is standardized. The benefits and services offered are all different with every single carrier, and even within carriers, there's lots and lots of plans available, and they all have different benefits and different co-pays and different co-insurances. So again, very, very important to have a independent broker who can look at all the plans and help you narrow them down, help you decide what's best for you individually, how you want to use your healthcare. Do you want more dental coverage? Do you need, I don't know, a specialist in a certain area that's going to have a very low copay? These are all things that I can look at and help you decide what's best for you. Advantage plans also have a maximum out of pocket. So you know you're going to be paying copays along the way. However, you also know there's an end in sight. There's a cap. There's a limit to how much you're going to pay. Hallelujah. Because again, you'll know that, okay, if I had my worst possible medical year ever in my entire life, I would only be paying up to my maximum out of pocket. And you'll know what that is. But again, that varies all over the place depending on carrier and different plans. So I can't give you an exact number because it's all over the place, but you will know that there is an end in sight, that there is a cap, there is a limit to how much you're going to spend. With Advantage plans, sometimes you do need to get a referral, but again, you'll just need to stay within your network. You're good to go. Another thing that Advantage plans offer is they like to give extra benefits. So you may have heard of something called Silver Sneakers. This is so cool. It's a gym membership that's just included in your Advantage plan. Wow. All of these plans usually also include dental, vision, hearing, and your prescription drug coverage covered in there as well. So one thing I do for my clients is I find out who your doctors are, what prescriptions you're on, what pharmacy you like to go to. I want all the dirt because I can put it into my system. I can find you a plan where your doctors are all in network, that your prescriptions are covered as much as humanly possible, and that your pharmacy is preferred. My goal is to keep your costs as low as possible. So here we have Advantage plan. You're paying kind of as you go through copays, co-insurance. You have to stay within your network and you have some added benefits, versus a supplement where you're paying a monthly premium on top of your Part B premium, but then beyond that and beyond your Part B deductible, your $240, no out-of-pocket cost. You're covered completely and you don't have to stay within the network. You can go wherever you want to go. And if you want to add on other benefits, you can definitely do that as well. So I'm pretty sure I have just blown your mind with the possibilities of the two options of how you fill in the gaps that are left with the Medicare if you just stuck with the original Medicare, which again, super bad life plan. Don't do that. Talk to me, we'll help you decide. Supplement, Advantage plan, they're both great options. You just have to choose one of them and go for it. All right, like and subscribe, tell all your friends, tell everyone you know. I am Lindsay, the insurance girl, and I'm here to help with Medicare.